IP Expedition Project on Sickle Cell Disease. What is sickle cell disease? Sickle cell disease is a blood disorder in which the body produces abnormally shaped red blood cells. Sickle cell disease is a genetic condition that affects 90,000 to 100,000 people worldwide. Sickle cells don't last as long as normal, round, healthy blood cells do. Healthy cells flow free in the blood, while hard, sticky sickle cells get stuck and block blood flow, which can cause pain and organ damage. What causes sickle cell disease? Sickle cell disease is a genetic condition. A person is born with sickle cell disease after inheriting one gene from each of their parents. A child has a 25% chance of getting sickle cell disease. What are some symptoms of sickle cell disease? Sickle cell crisis, which is joint and bone pain. Acute chest syndrome, which is pneumonia. Abdominal crisis, which is stomach pain and stroke. Symptoms occur when the body does not get enough oxygen. Symptoms can range from mild to severe. Some treatments of sickle cell include transfusions, healthy food choices, IV therapy, and medication. Is there a cure for sickle cell disease? To date, the only cure for sickle cell disease is the bone marrow or stem cell transplant. During this procedure, healthy cells are taken from a donor and put into someone who has unhealthy cells. A bone marrow or stem cell transplant is a very risky procedure that can cause death. Most people are afraid of having this procedure done. Conclusion. Sickle cell disease is a blood disorder that many people live with. Knowing the causes, symptoms, treatments, and potential cures can help you make wise decisions and live happily. My action plan. I am currently involved in sickle cell research at Children's Healthcare of Atlanta, where I donate blood so that it can be tested to see how well transfused blood survives in the body until the next transfusion. My blood is also used to find other cures and treatments for sickle cell disease. September is National Sickle Cell Disease Awareness Month. Every year, my family and I donate money to the Sickle Cell Foundation of Georgia. Each year, the Sickle Cell Foundation of Georgia hosts a camp for sickle cell patients. It's called Camp New Hope. I also attend this camp. It allows me to meet other kids with sickle cell disease and stay active.
What you did.
Brilliant.
It was
Very
very
nice.
nice. Very nice.
Very good.
Makayla, while you're here, will you tell us a little bit about what you have on the table?
Here is a sickle cell disease, and that is a normal red blood cell. And in this jar, I have red beads to symbolize the round sickle cells and foam to symbolize the sickle cell. And as you see, it is hard for the sickle cells to move around.
Why don't you walk those over and show everybody? Show